when you're dealing with patients with schizophrenia, say the chronic people who have neurocognitive problems in attention and memory and so on, you have to do the cognitive restructuring in a very subtle way. And in fact, it's so subtle that nobody can recognize it except yourself. So one patient that my group was working with is a patient who'd been in the hospital for something like 10 years, and he was always behaving in a really negative way. And his most latest problem was that he was running around nude, and they'd force him to put his clothes on and take them off again. He was causing a big problem. So our therapist then tried to engage the patient, he'd been fairly non-communicative up until then. So he tried to engage him, and he said, I guess there's one thing is the patient liked music. And so he played some music, and then he would ask the patient if he could recognize different piece of music, and then he played some video games with him. Then after he had formed this relationship with him, he asked him, what would you really, when you were growing up, what do you really want to do more than anything else? And you never ask these patients, what are your goals? Because they either come out with stereotyped things or they think you're trying to push them out of the hospital. So he said, what I really wanted to do was to be an auto mechanic. I really wanted to be a machinist or an auto mechanic. And then he started to get enthused, and he talked more in the next 15, 20 minutes than he did in his entire stay in the hospital. And the therapist got him to describe what he would do as an auto mechanic. And he was just going along saying how great it would be putting the grease in and turning the screws and fixing the carburetor. And then all of a sudden he stopped. He says, I won't be able to do it. And the therapist said, well, why is that? And he says, well, there's these little tiny screws, and you have to use a tiny screwdriver. And I won't be able to see it. So the therapist said, well, when did you have your eyes tested last? And the patient said, well, I never had my eyes tested. So he had his eyes tested, and he got eyeglasses, and then he knew he'd be able to do the job. And from there on, it was a straight line till he was able to get discharged from the hospital. So where's the cognitive formulation come in? The cognitive formulation was that this person felt defeated. He felt that he wasn't able to do anything. He felt ostracized from society. And so his behavior was sort of defiant. It's just this way of getting back at the ward personnel who were giving him, trying to force him to do things, take medicine and so on. So his nakedness was the defiant part. But when he could think of something and get supported in this, to something that would give him a sense of efficacy and self-confidence and achievement, then the defiant behavior then dropped off, and he put his entire focus on that. So the similarity is trying to formulate what is driving the behavior, and once you've made the formulation, then you do the therapy.